the Keeping Families Safe team from Peninsula Health will be drawing upon research and practice knowledge in highlighting work alongside young people demonstrating violent or harmful behaviours who live with a disability. Ali LaRocca is a social worker with 15 plus years of experience working in the public health sector. Ali has now been the senior clinician of Peninsula's Health Keeping Families Safe program for the past 16 months. And the lovely Jack King is a dedicated social worker with almost 5 years of experience supporting young people facing complex mental health challenges and social disengagement with secondary school. He transitioned to Peninsula Health Adolescent Violence in a prime role where he continues to advocate for and empower young people navigating complex family issues. Ali and Jack, welcome.
Thank you. So firstly, the Keeping Families Safe program would like to acknowledge the local traditional owners of the lands on which we gather today. We also acknowledge the Boonwurrung and the Boonwurrung on lands of which we work, and the people of the Kulin Nation who have been the custodians of this land for many thousands of years. We pay respect to their elders, knowledge holders and leaders past and present. We acknowledge that land on which we meet is the place of age-old ceremonies, celebrations, initiation and renewal, and that the living cultures continue to have a unique and important role in the life of the region. So a bit about what we do and who we are. So as Lisa introduced, I'm Ali, the Keeping Families Safe Senior Clinician. And it's a pleasure to be here to present on the complexities of adolescent violence in the home and its intersections with NDIS services. So I'm going to start with a brief overview of our program and how we came to identify the topic. But Jack will give you a quick overview and snapshot of his role.
Guys, thank you. My name is Jack King. I am new to the Keeping Families Safe team, however, not new to the intersection of AVITH and young people with disability. I will be presenting on the practical strategies and approaches we look to implement while supporting the young people that we recruit. Okay,
so the Keeping Families Safe was one of the first 3 pilot programs, and we work with the young people, individual family members and the entire family unit in a non-blaming and non-shaming way, and seek to understand the different viewpoints from all of them. In our work, we aim to empower adolescents to recognise their use of violence and aggression and encourage change by helping them to understand their emotions and the impacts their behaviours have on themselves and others, whilst also addressing challenges to do with school disengagement, substance use and youth mental health. We aim to support young people, their carers and family members to develop skills which promote non-violent conflict resolution and effective communication skills, along with supporting families to strengthen their parenting strategies to improve relationships and communication. So let's set the scene and look at why we chose the topic. So the research tells us that young people with disabilities are overrepresented in reports of young people who engage in the use of adolescent violence in the home. And what we've heard this morning was really resounding for me to go, we've picked the right topic. The research tells us that young people with disabilities are overrepresented in reports of And because of this, these young people are at a higher risk of entering the justice system and being recognised by child protection in the out-of-home care space. Within our Keeping Families Safe program, over the past 12 months, we have received a high number of referrals where the adolescent using violence was noted to either have a diagnosed disability or was reported to be living with a suspected disability. It was noted in these referrals that only a small portion of these young people are accessing NDIS funds, with each of these funded plans offering a variety of interventions and therapeutic supports. These referrals challenged our practitioners to recognise the existing specialist system linked with the young person and their family, and to then determine how best to tailor our role to support the presenting needs. So let's break down the data and take a look at the overall referral context. As mentioned, our service observed a high volume of referrals from the period of Feb 2024 until Feb 2025, where disability was an intercepting factor. We received a total of 92 referrals in this period. Out of these 92 referrals, 68 referrals noted that the young person had either a diagnosed disability or a suspected disability, with 19, so just under 1/3 of those 68 cases, receiving funding and support through an NDIS provider. A total of 24 of these cases did not identify a diagnosed or suspected disability at the time of referral or across the engagement period. The broader AVITH research supports the themes and distributions of referrals we are experiencing, with young people with a disability continuing to be overrepresented in engagement. As AVITH practitioners, we recognise that disability is not considered a causal or risk factor attributing to AVITH. However, the diagnosis of a disability allows us to consider the further complex and intersecting needs of the young person and their families. Consideration needs to be taken into how we formulate our approach to the case. So, when we're looking at formulating our approach to a case, specifically where a young person is using AVITH and has a diagnosed disability along with formal NDIS supports, we need to be attuned to the complexity of needs and the potential for service overload. By acknowledging external and internal services and supports the family may be utilising and engaging with, we are able to define priorities and determine collectively how best to draw on those systems whilst being considerate of the capacity of everyone involved. Through a continuous commitment to communicating as a care team and including the young person and their family members, we can ensure realistic expectations of engagement are met. And a community care team provides opportunity for constant re-evaluation of the young person and the family member's readiness and their ability to engage in supports and services. To ensure practitioners and services are not overloading young people and their families with service saturation, we need to be open to discussing and adjusting priorities throughout the support period to best reflect the needs and goals of the young person. Recognising the overall AVITH experience is increasingly isolating, it is identified within the research how further complex and challenging the circumstances are with intersecting needs such as disability and how they may not be adequately supported and considered. As AVITH practitioners, we encourage youth-led discussions and look to work with the young person to acknowledge their decisions on whether they identify themselves with a disability and how or whether they choose to disclose or discuss their diagnosis. We facilitate an environment where conversations can support the young person's communication style and needs, with the goal of building an understanding of the young person's preferred methods of communication, whether that be via phone, text, email, or face-to-face. This understanding empowers the young person's autonomy, providing them the opportunity to reflect on their level of readiness and identification of their own needs to lead the provision of support. When looking at accessibility and rights, NDIS multidisciplinary care teams are established to provide support for young people with disabilities. They are there to uphold the rights of people and promote safe and inclusive environments. NDIS multidisciplinary care teams should be working towards addressing any barriers to access or communication and be able to make adjustments to ensure the young person can engage with the provided supports and communicate their needs, wants and priorities. Through conscientious collaboration, NDIS multidisciplinary care teams have the ability to keep the young person's voice at the forefront of the provision of support. By doing this, we are recognising the importance of maintaining the young person's needs whilst acknowledging their safety and wellbeing goals, along with any potential risks. Through open communication and continuous and regular reflection with the young person, we are able to support them in identifying their immediate needs and priorities and any potential challenges which may have arisen or have the potential to arise.
Thank you, Kelly. So continuing on from the case formulation, so collaboration with NDIS specialists. So when working in an NDIS multidisciplinary care team, service specialists can include, but are not limited to, behavioural support practitioners, occupational therapists, support coordinators, and the young person and the family unit themselves. As in our experience, it's really important that we recognise that the family and the young people as specialists themselves, as it is with their wealth, knowledge, and experience, in the family home. It is very vital towards that support provision that they may be seeking in that regard. Assessing suitability to include the young person and their family in the NDIS multidisciplinary care teams, or exploring the desire to become involved. And it's empowering for them to see that there are teams available for them to support them for their needs. Aligning with the NDIS goals. So as an NDIS multidisciplinary team, we work together to align the goals. So the goals we're working with the young person and the family, and the goals that are aligned from NDIS as well. Given that the NDIS multidisciplinary care teams are often pre-existing before they're linked into our service, we look to integrate adolescent violence in the homelands into existing or commencing interventions and specialist supports, rather than reinventing or duplicating support structures and strategies that are already implemented. So where to from here? So the first point is, so advocating for adolescents with disabilities who use violence in the home requires navigating the NDIS system to ensure that they and their families receive the right supports. It involves actively addressing the complex interplay between their disability-related needs and the challenges within the family environment. The advocacy may include guiding families through appropriate NDIS services, ensuring behaviour support plans are implemented effectively, and working collaboratively with service providers to prioritise the safety and well-being of all family members. By amplifying the young person's voice within the NDIS system, it is possible to create tailored solutions that address both the immediate concerns and the long-term capacity building for the family. So next part will continue. So understanding behavioural support plans is essential to bridging the gap between the family's current needs and the work of behaviour practitioners. For adolescents with disability, where violence is being used in the home, these plans provide a structured approach to managing challenging behaviours whilst considering the unique dynamics of the family. By gaining insight into the strategies and goals within these plans, families can engage more effectively with practitioners, fostering a collaborative effort to create realistic, actionable solutions that prioritise safety, support, and long-term growth for both the adolescent and the family. As part of the behavioural support plan, it consists of several key components that aimed at understanding and addressing challenging behaviours while promoting positive change, including assessment of behaviour, which is a detailed analysis of the individual's behaviour, which includes the triggers, patterns, and underlying causes, often using tools like functional behavioural assessments. Goals and objectives, so specific, measurable, and achievable targets designed to reduce problematic behaviours and encourage desirable behaviours. Strategies and interventions, so tailored approaches such as positive reinforcement, skill building techniques, or environmental modifications to address the identified behaviours. Crisis management plans, so the appropriate steps that are being put into place to ensure safety and manage behaviours during critical situations. Collaboration and training, so input from family members, caregivers, professionals to ensure everyone involved understands their role and that they can effectively implement the plan within the family home. And then on that, the monitoring and evaluation, so regular review of the plan to track progress, adjust strategies, and ensure that interventions are meeting the individual's needs. By incorporating these components, behavioural support plans provide a structured and holistic approach to fostering positive behaviours and improving quality of life. So setting realistic expectations involves understanding the unique challenges and dynamics within the family home while addressing adolescents with disabilities who use violence. It requires respecting and incorporating diverse perspectives, including those of parents, siblings, and caregivers, to ensure all voices are heard and valued. By fostering open communication and balancing different viewpoints, practitioners can develop practical, achievable strategies that both supports the adolescent's needs and the family's capacity to implement change, promoting a more harmonious and collaborative environment. Building family capacity involves empowering families to navigate the NDIS system and connect their adolescents with appropriate supports to meet their specific needs. For young people with disabilities who use violence in the home, this process includes identifying and linking them with tailored services such as behavioural specialists, therapeutic supports, and respite care. By addressing both the individuals and the family's requirements, these connections can help reduce stress, enhance overall safety, promote the skills and resilience required to manage challenges effectively. Adapting to the young person's needs requires a responsive and collaborative approach that prioritises effective communication and proactive action. Sharing information appropriately ensures that everyone involved, including family members, are informed and aligned. Regular monitoring of behaviours combined with timely interventions helps address concerns while involving the family to maintain a supportive and inclusive environment. Participating in meetings with health professionals provides valuable insights into behaviour support plans, enabling families and practitioners to implement strategies effectively and create meaningful, positive change for the young person in their household. Through a trauma-informed lens, we recognise the impact of past experiences of a young person's behaviour and ensure our approach is compassionate, strengths-based, and focuses on safety, healing, and empowerment. And some of our approaches that with any communication, sharing that communication appropriately with the young person, monitoring and intervening as needed, especially with the family involvement, and participating in meetings with health professionals to better understand and apply behaviour support plans effectively. Thank you.